The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
I appreciate you letting me all talk to you today. This is a topic that I deal with quite frequently, and one that's very important to a lot of men, of course. So let's go ahead and get started talking about some testosterone replacement therapy. So first of all, what is testosterone? A lot of you, of course, are, I'm sure, familiar with it. This is really the male hormone. It's produced primarily by the testicles in a man, but also there's a small percentage that's formed by the adrenal glands. And what it does is it's responsible for many, many male functions. And that cartoon on the right side of the screen goes over some of those. Usually a testosterone level will start to spike, and it'll spike during puberty itself. And that's what spurs the development of the testis, scrotum, pubic hair, the body shape that's more characteristic of a male. Some of the muscular growth, and of course fertility, and it also is important for starting the development of involuntary erections, which you start to see around puberty for men. Natural testosterone levels kind of level off in their 20s, and then they plateau for a while. Around age 30 to 35 is when you see that plateau continue to maintain itself. Then it's after that that you start to see the testosterone start to go downward. On average, it's thought to go down about 1% per year thereafter. Men often have a good reserve amount of testosterone, so for most men it will not affect them, but for some men that 1% per year decline can result in a testosterone level that becomes so low that they start to have symptoms. For other men, there are other causes that can cause to go down a little lower, and we'll talk about that as well. When your testosterone level is low, you start to feel it. You know, the testosterone is responsible for many things, kind of described on that right side over there. The skin, the bones, the muscles, it's very important for body composition, particularly hair growth, density of your bones, so it helps to reduce the fracture risk, and of course strength to your muscles. It also affects the sex organs. This is what is probably most commonly associated with. Testosterone is responsible for mood or libido, so sexual interest, which is very important for good erections and good sexual intercourse. And then, of course, the brain. It can affect mood, confidence, memory, and you know, very important for overall just sense of well-being is what a lot of my patients will say. So what is low testosterone? Low testosterone in some ways is kind of a number. You know, we generally, in the urologic literature, we define it as less than 300. When you're less than under 40 years old, however, that number needs to kind of be adjusted. So when you're less than 40, less than 400 is considered to be an abnormally low testosterone. When you're over 40, less than 300 is considered to be an abnormally low testosterone. That's quite unusual for a male under 40 to have low testosterone levels. It tends to happen later on in age because of that natural decline of 1% per year, of course, but it can happen to younger men as well, and I've seen that many times. The definition of low testosterone is not simply just a number, though, it's also symptoms. So when you have a low number, but also it's accompanied by different issues, maybe it's sexual dysfunction, changes in body composition, you know, decline in this feeling of well-being, this is how you define a low testosterone, and that's when you think about supplementation. It is a little bit more common in certain patient populations. Men who have obesity, they have a more higher likelihood of a low testosterone level, and that's actually because when a man has a obesity, the adipose tissue that's in the fat will actually convert the testosterone to estrogen. And that, of course, is not the usable form of the hormones that males need. And so when you have weight loss, that's one of the natural ways to improve testosterone levels. Also diabetes, high cholesterol, high blood pressure, this is called the metabolic syndrome. Men who have these characteristics are more likely to have low testosterone levels. So suppose you get diagnosed with low testosterone, you're having these symptoms, maybe you're having a low sex drive, your mood is changing, You're not gaining as much muscle mass as you used to when you went to the gym. You're starting to gain weight, even though you're having a good diet and exercising. And then you have your testosterone level checked, and wow, it's below 300, or for the younger people, below 400. What do we do about treatment options? Well, there are multiple treatment options that are available, and we'll go through each of these one by one. Let's go ahead and start with the topical gel. So topical gel is probably one of the most common ways to supplement testosterone. It's easy, and that's probably why it's so common. Gel is probably the most common formulation to give it with, although it can also come in foams and things like that, where you can do it in pumps. What you do is you apply that to your hands at a predetermined amount, and you put it in an area of the body where there's a high surface area. And the shoulder tends to be the most common. It's easy and convenient to reach with a good amount of surface area, and often with a little bit less hair in that region, so it's more likely to be absorbed by the skin. It's nice because it's easy. It's very straightforward, but it's not nice for a couple other reasons. Number one, you do have to do it every single day, so it has to become part of your habit. Also, I'm down in the South in Atlanta, so sometimes folks, when it's really hot, they tend to sweat a lot, kind of, so it can somehow get off of them, so they need to put it and kind of wait inside for a little while so it has a chance to absorb before they go outside. Men who have a lot of hair, sometimes that can disrupt things as well. But overall, when men get the hang of it, they usually do a pretty good job using it. Once they're really, in the habit of it, they have nice consistent numbers. Maybe men initially may not, just because they're kind of getting the hang of applying it properly. So another thing to know about the gel or topical testosterones is it's transmissible, right? You're putting it on your hands and you're putting it on yourself, which is what you want, but you want to avoid passing it on to folks that shouldn't have it, right? So your spouse or your loved ones, your kids, your pets, you want to avoid, touching them right away. Clean your hands really nice and clean. Make sure there's no residual that's gotten stuck between your fingers, so you don't expose others to that testosterone. Usually the starting dose is 50 milligrams of testosterone daily. When it's done in a gel form, we then slowly monitor you with your labs to see if that's an appropriate amount for you. Testosterone supinate injections, probably one of the most popular ways as well. Gels are very popular, but the injections are very popular as well. These are done either at home or in the practice office. Most men will actually learn how to do it on their own, so they can do it in the privacy of their own home. And this is a liquid formation, so you're actually drawing it up into a needle and then injecting it directly intramuscularly, so it'll get into the bloodstream for you by that mechanism. It's nice because it's getting right into your body, so it's not like gels where it can get sweated off or kind of get on your clothes or on your hair. It's going directly where you need it to, and it gets absorbed quite quickly. So the effect is generally pretty quick in terms of when you see it. Usually within 2 to 3 days after an injection, you'll see that amount peak, and you start to see a response right away, but 2 to 3 days is where it peaks. So that's nice, right? You kind of get an effect right away, and it's a reliable amount. But then the opposite is true, that it goes up, it also goes down relatively quickly. So sometimes men will have a bit of a yo-yo effect where it goes up, goes down, goes up, goes down. And that's why we do it a little bit more frequently when we're doing the injections. Most men, when I'm doing injections, I do it at least once a week. For a motivated man, I'll do it twice a week. That's actually the ideal, is have a small dose that's done quite frequently. That way you keep a nice maintenance dose. When you're using it, there are generally 2 needles that are used, an 18 gauge needle and then a smaller needle, usually between 23 to 29 gauge. When we're talking about gauge of needle, a smaller gauge is actually a bigger needle. So an 18 gauge needle is rather fat, and it's used to draw up the medication. That's important because the medication can be a little bit thick sometimes. It's kind of an oil base, so it's a little bit thick as you're pulling it up. Then you switch out to a smaller needle, and then you inject it into the body. Smaller needle, of course, because it's less painful to do it that way. Like I said, we'll usually teach men how to do it in the office, bring them back as needed for a teaching visit, and most men are just good to go on their own afterwards. Other benefits, rather than the fast on, fast off, is there's no risk of transfer to others. Skipping or stopping will cause it to drop. That's, of course, sometimes a disadvantage, but also sometimes an advantage, right? I'll often start people on gels or injections because they can also stop it if they need be. If they're monitoring their levels and they start to get a little too high, we can drop it and it'll relatively quickly come back to where it needs to be. The cartoon on the right side of the screen shows you where you're injecting it. You're going through the skin and the subcutaneous fatty layers and right into the muscular layer, and that's where you provide the injection. It's often done in the thigh muscles, sometimes the gluteus muscles, which is in the butt. Those are probably the two most common places that men do it. Testosterone pellets, this is another great way to do it. One way that I do rather like. It's nice because it's a quick procedure. It's generally done by a physician or someone in their team. And basically you're making a tiny opening in the skin. So you're numbing up the skin, usually in the fatty area that's right above the butt, not in the area that you sit, but above that. You make a tiny opening, it's about 1/8 of an inch. You numb it up and then make that tiny opening. You pass a little trocar, which is a cylindrical-like device that goes down into that subcutaneous tissue near the fatty layer. And then you put these little pellets of testosterone in there, pull the trocar out, leaving the pellets in the layer that you'd put them, and then close up the skin. It's a nice option because it's quick. Rarely takes more than 5 minutes for an experienced provider to do it. It's relatively painless aside from that initial slightly numbing medication that you put in. After that, men really don't feel anything, and even that's relatively minimal. And it's a set it and forget it situation, right? These tablets are made so they're slow, extended release. So it really mimics the body's natural way of giving testosterone, which is a slow and sustained way of doing it. But eventually those pellets will dissolve. It all depends on how much of those pellets that you use. We usually start, at a certain dose. I'll calculate it out depending on how much injection a man may have been using previously. Start with that dose, monitor their levels to see how they do, and kind of move forward from there. Usually at about 6 weeks is where you see the peak with the pellets, and then we'll check again at around 12 weeks to see if it's maintaining itself, and then every 4 to 6 weeks thereafter. Now, this is in the initial stages when we're kind of testing things out for men to see how well it works, but we have to individualize it. I've found that men metabolize testosterone quite differently from male to male, and so we kind of check it regularly at first. And this is true not only for the pellets, but also with the other forms of testosterone replacement, kind of watch on an interval basis to make sure that it's maintaining itself and adjust the dose as we go as needed. Natural dietary supplements, that's of course another way to do it. MenMD's actually got a great supplement here. You can see the ingredients on the right side. DHEA has always traditionally been the most common supplement that's utilized. That's basically one of the building blocks for testosterone. So testosterone is built, goes through several steps, and this is one of them that's utilized as a building block and turns into testosterone. So the thinking with natural dietary supplements is if you encourage the body to utilize these building blocks, it'll make its own testosterone. You're kind of providing the ingredients so it can make it a little bit more efficiently. This, of course, is not as powerful or as potent as giving the testosterone directly, which is the end product. But for a lot of men who have kind of like a mild decline in testosterone, want to try maybe some natural therapies before they commit themselves to medication, or just want something a little bit of a supplement to kind of help to boost things while they're undergoing replacement, it's a great option and actually quite safe. So this is another thing that I sometimes consider for my patients as well. So how effective is it? And then the risks. These are two very important things. So how effective it is really depends from man to man, right? The symptoms of low testosterone that we described can be a little bit, vague, right? Some men just have decreased energy, fatigue, decreased muscle mass, changes in their mood. Very easily could be testosterone, but could be other medical issues as well, right? So most of us as providers will screen for those other things, hypothyroidism, diabetes, that kind of stuff to make sure we're not missing anything. And if none of that is the case, then we do the testosterone replacement therapy and we ask you, well, how do you feel? We will reassess at the appropriate time interval depending on the type of medication, the type of testosterone that was given, whether it was transdermal like the gels, injection related, or pellet, because they all metabolize at different amounts and reach their peak levels at different points. And then I say, how do you feel? If men feel better, well, great, we continue the testosterone. If men don't feel better, then we reassess. Have the levels really gotten to the point where we want them to? Do we have more room to move? On rare occasion, a man will have a great testosterone level and are not feeling the improvement. At that point, we discontinue treatment because there might be something else going on. Fortunately, that's usually not the case. Most experienced providers, when we see a low testosterone level, we can identify the symptoms, rule out some of those other medical problems initially, and then go ahead and replace and make the man feel a lot better. There is some evidence to say that it can do not only improve mood and libido and ability to gain muscle mass, but also bone strength, which makes sense, right? Blood sugar control is another thing that people have described might improve with testosterone, and there have been some studies that also tied to better cardiovascular health. So and that's I'm not very surprised at these findings. It's the male hormone, right? And so if it goes down too low, I'm not surprised that multiple aspects of a man's health can suffer. Risk, there's always a risk with any sort of medication. One of the most important risks is actually blood clots. So what testosterone does is it also encourages more red blood cells to be formed by the body. And if too many red blood cells are formed, then it becomes too thick and the blood becomes more viscous. And that's when blood clots can form. Blood clots can either stay in the legs or, God forbid, could spread to other parts of the body, like the heart and the lungs. And that's why that's a pretty major side effect or risk that we need to be aware of. We monitor your blood counts very closely if you're on testosterone replacement therapy to make sure you're not at risk for that. Some men I'll put on a blood thinner like a daily aspirin or otherwise to kind of reduce that risk. Some men, if they get really high blood counts where their blood is getting thick, then they can also donate blood, kind of decrease their blood counts that way also by doing what's called a phlebotomy or often donation. But we can monitor that again with the blood counts. Storage, how do you store it? It really depends on the type that you're using. Most of these can be stored at room temperature. They don't require a whole lot of maintenance to store the medications. Now I'll go back to risks a little bit. There's some pretty big papers that came out in the literature about 9-10 years ago in some big journals, Lancet, JAMA, about how testosterone replacement therapy may increase the risk of a man's risk of a heart attack or a stroke or really serious things like that. Now, I'll tell you, since then, there have been multiple papers that have come out that have said, maybe not so fast. Actually, that might be more the case for people who are going for really high levels. So they're going above that 900 threshold where a man probably should not be going above, and that's when the blood clot risk gets high, and then you can, of course, have some of the consequences of that. And there have been papers, like I mentioned, may actually improve cardiovascular risk. So we've actually got some pretty big trials in the works. I was involved in a randomized controlled trial, national trial, about 150 centers, one of which was mine, where we actually are giving testosterone replacement therapy for men who traditionally you would not. So with cardiovascular risks, maybe a history of a heart attack, things like that, to see if is it really safe for those men or not. And the results are still being tabulated, so stay tuned. But a lot of the initial smaller studies have suggested it's probably going to be pretty positive, and hopefully we can debunk this this idea that it's blanket not safe, for certain men who have cardiovascular risk. But again, we'll wait for the data before we can say that. So what should you do if you're concerned? Talk to your physician. Because they need to also consider other things. So if you have prostate cancer, one of the risks of testosterone supplementation is that it can be fuel on fire. Prostate cancer actually feeds on testosterone. So a man, if they're getting testosterone while they've had a prostate cancer diagnosis, that'll accelerate their rate of prostate cancer growth. So it's very important. I screen all my men for a PSA test, which is a prostate cancer screening test, to make sure they're not at risk for prostate cancer to begin with. And if they have a very low risk, then it's relatively safe to proceed. Now, some men, if they've had a history of prostate cancer and were treated, maybe they had surgery, they had radiation, and now had low testosterone, traditionally, a lot of providers would refuse to give testosterone after that. The thinking was, well, what if it flares up a recurrence of prostate cancer? that was a little bit of old school thinking. And, in the modern era, there are a lot of papers, a lot of research studies that are suggesting if a man is closely monitored, it's very safe to give testosterone replacement therapy, even if they've had even if they've had a history of prostate cancer, provided, of course, that they were adequately treated for that prostate cancer. So it should be gone. So, which testosterone replacement therapy is right for you? It's a decision that you got to make with your physician, right? Most men will start with either a gel or injection. I'll say that's probably the most common. They'll start with that. Many will kind of stick to that just because they get used to it and they're finding that it's working well. But some men will transition to pellets if they don't want to have to deal with that, daily or weekly or bi-weekly kind of administration. Testosterone supplementation, of course, the supplement has its role as well, as I discussed, so often as an adjuvant or sometimes in cases of borderline testosterone levels as something that can be used as a primary treatment. So, that kind of brings us to our questions and answers. We got plenty of time for that. A little bit of a whirlwind tour of testosterone replacement, but there often are very specific questions, and I'm happy to address those.
First one here is, what are the immediate signs that one has low T?
So, some of those we went over, but I'll tell you, what are the more common ones? A lot of men will describe like a decreased sense of well-being. They just don't feel as, good. And that's often manifested as decreased energy. Maybe they're sleeping more, their mood is changing, they're not as lively as they used to be. They have less sexual interest, which is known as libido. These are the most common first signs that I see. Other common signs include decrease in muscle mass. They're going to the gym and they're working out, but things just aren't working out the way they used to. They're starting to gain weight even though they've adjusted their diet and they're doing exercise. These are by far the most common symptoms that I hear about.
Alrighty. So what is the difference between low energy due to hemoglobin count and testosterone levels?
So that's a great question. So what the hemoglobin count is, it's a surrogate for blood cells, how many red blood cells you have. Now what the red blood cells are doing is they're responsible for taking oxygen and dispersing it all over the body. So they're kind of like the little fuel cells that are passing it all around the body so you have the energy to kind of do your work and live life. When you've got a low hemoglobin level, you've got less of those batteries going around, right? So less of that oxygen is being passed around to your body to be consumed as a fuel. And that's the mechanism by which you have low energy when you have a low hemoglobin level. Low hemoglobin levels can occur for a variety of reasons, certain diseases. Low iron levels are probably the most common because they're less being produced. Testosterone is completely different. So testosterone is the male hormone, and it's responsible for energy just by virtue of how it works in terms of stimulating the body in a little bit more of a complex fashion. It's not just as straightforward as passing oxygen to the rest of the body. So one of the things, but what you brought up is very important, because one of the things I always check before I start testosterone for a man is I make sure they're not anemic, so they don't have low hemoglobin levels. So I check what's called a CBC, a complete blood count, and I'll see what their blood counts are at present. If they're normal blood counts, that means their hemoglobin is fine. That's not the issue. And then we move forward with testosterone replacement.
Alrighty. Next question here. Are there any foods, if any, that would lower testosterone levels?
So that's, one thing overall is diet. So one of the things you probably saw in the beginning of the presentation is men who have high cholesterol levels, obesity, hypertension, which means high blood pressure. This is all known as the metabolic syndrome. They tend to have low testosterone levels. So what causes metabolic syndrome to some degree is genetic, absolutely, but also it has to do with our exercise levels and our diet. So a heart healthy diet is actually a pro-testosterone diet. A heart poor diet is going to be an anti-testosterone diet. So if you're having a lot of, fried foods, fatty foods, unhealthy kind of foods, all the things that you hear about that are poor for heart health, that is unfortunately also going to result in high cholesterol levels, more adipose tissue, which is more belly fat, and it's going to result in low testosterone. So basically, heart health is testosterone health.
Alrighty. Next question here. What is free testosterone, and is it the same as regular low testosterone?
So that's a good question. Free testosterone is the testosterone that's actually more readily utilized by the body. It's not the same as total testosterone level because testosterone can be bound by certain proteins, so it's not quite as available to be used. But when it's not bound, it's more available and it can be more freely used. And so many times we'll look at the free testosterone level to see if that's within normal limits. Occasionally I have a man that's got a good normal total testosterone level, but the free testosterone is super low. So, you're really not accomplishing what you need because the good stuff, the stuff that you need, is not available for your body. It's also a little controversial, however. Why is that? Because the assays or the blood tests that are done for free testosterone are not the most reliable. Total testosterone blood tests are very reliable. Free testosterone are not quite as reliable. So that's resulted in some national bodies saying that, hey, you shouldn't even use the free testosterone level because of lack of reliability from lab to lab. Rather, you go just by total testosterone level. Personally, I feel a little bit differently. Yes, total testosterone is probably the most important number because it's the most consistent, but in the least internal variability, we call it. But there's definitely a role for free testosterone. I check it in almost all men. It can often be a tiebreaker for me, and also it can help kind of do those minute adjustments in terms of how much I'm going to supplement and how.
Ready. Next question here. Over a 5-year period, my testosterone level has unexplainably increased from 195 to 585. What may have caused this?
So you're probably doing the right things, I would hope. So weight loss, good diet with high amounts of exercise, good amounts of sleep at night. These are all the natural ways that a man can boost his testosterone. For sleep, you want to get at least 8 hours a night of sleep. If you can do that, that's shown to boost testosterone levels. For exercise, 3 to 5 times a week, you want to get that heart rate up to that target heart rate for a sustained 20 to 30 minutes. That's proven to get testosterone levels up. A nice heart healthy diet like we were describing has been shown to, of course, decrease cholesterol levels, decrease levels of obesity, and decrease your risk of diabetes, and that can make a huge difference too. For some men who have some of these comorbidities or diseases that can result in low testosterone, like diabetes, high blood pressure, cholesterol, managing those primary problems will also result in better testosterone levels. So that's great. Keep up the good work.
Alrighty. Next question here. I developed ED at age 26, and a workup revealed a total testosterone level of 240 with other labs being normal. Does that level of testosterone correlate with erectile dysfunction?
Maybe, maybe not. And this is an interesting thing to talk about. So testosterone, although it contributes to erections, particularly spontaneous or nighttime erections, doesn't always completely isn't completely responsible for erections during sexual activity. Testosterone, however, is very important for libido, and then libido is very important for spontaneous erections. So if your testosterone level is low and your libido is very low, then there's a higher likelihood that this low testosterone is responsible for your erectile dysfunction. There are other ways, it's a long conversation about causes of erectile dysfunction, something I deal with very frequently, especially in the young male. It's a special circumstance. It could be due to blood vessel issues known as arteriogenic erectile dysfunction, could be due to nerve responses, that's neurogenic erectile dysfunction. And then sometimes it can be what's called psychogenic erectile dysfunction, which is often stress related. When a man has a high stress hormone levels, then that results in upregulation of what's called their sympathetic nervous system, and that also will inhibit erection. So, there are multiple potential causes. Could testosterone be one of them? It's possible, but it depends on your specific situation. If it's a low testosterone and a low libido, yes, there's a higher likelihood it might be at least some contributing factor.
Alrighty. And a bit of a review question from the chat here. How can testosterone levels be tested? Can I request this be tested with my regular lab work from my doctor?
That's a great question. So it should be done with lab work. So it's a blood test. The key, however, is to check your testosterone level between 8 and 10 in the morning, ideally. Testosterone levels are known to fluctuate throughout the day, and so between 8 and 10 is really the normalized values, and that's the benchmark for which we have all of our national studies and national trials that kind of evaluate the use of testosterone. So you want it done in the morning. You can do it with the other labs, but again, they have to be done during that time interval.
Alrighty. Next question here. Generally, what is a good testosterone level for a 66-year-old male?
So, I like to see something above 300 is what the guidelines suggest. But my target is usually around the 5 to 600 range at that age range. I like that because I find that when you're around 5 to 600, most men are feeling it. They're feeling better. They're feeling a good response. They're not down skirting that 300 to 400 range where it's a little bit borderline and maybe I could do a little better for them. And they're not so high at that range where it's like 8 or 900. And that's when you start to see a higher incidence of some of the risks, particularly blood clots, which can be caused by high CBC, hematocrit, or hemoglobin values.
All right. Next question here. So this person says that they're in fairly good shape. They are about 59 years old and they go to the gym exercising frequently, but whenever they leave the gym, they believe that low testosterone is affecting their mood. Is this possible, and what can they do about that?
So I think what I'm getting from that is that they're having some symptoms, but not all symptoms. So they're able to exercise and work out at the gym, but they're worried that their mood and other aspects may be affected, and they wonder if low testosterone could be responsible for it. Yes. So, although testosterone is responsible for many things, I often do see isolated, symptoms. So, so for some men, it's more of an exercise muscle gain sort of issue. For other men, it's a sexual libido issue. For other men, it might be a mood issue. And for some men, it's all of the above. So, men can really react differently to having lowered testosterone values. And I think, frankly, it's just because we're just human beings are amazing creatures. We have an incredible ability to adapt. So even though the testosterone level may go down, our body finds other ways to keep us functioning, right? And all of these things, whether it be muscle mass, mood, libido, it's multifactorial. Although testosterone is a part of it, there are other parts of your body and your health that are responsible for maintaining it as well. So you might see isolated symptoms, yes.
Alrighty. Next question here. Can one start and stop testosterone replacement therapy with no long-term side effects?
So that's a great question as well. Yes and no. So a few things to know. Once you start testosterone therapy, if you've been on it for long term, your body often will stop making its natural testosterone. So, if you start at a level of testosterone and you're having it supplemented, your body's going to say, hey, I don't need to make this anymore. It's a little more complex than that, obviously, but more or less it says, I don't need to make this anymore. And it stops producing its natural testosterone level. So if you were to suddenly stop the testosterone, you're going to find that you won't go back to what you were before you started testosterone, but rather you'll go even lower. And so men can often feel those symptoms come back and come back pretty hard if they suddenly stop the testosterone. Now, if they slowly wean down the testosterone, it kind of depends. It gives their body a little bit of a chance to recognize that it's not being produced, so maybe it'll start to kickstart itself. That's sometimes possible. But if it's been used for a really, really long period of time, sometimes you're never going to get back to that level. So this is kind of where the art of medicine comes in. If a man is thinking about decreasing his testosterone, I think you really need to work with your physician to come up with a plan for it. I do have some men that have decided they want to wean off of it. Maybe they just don't want to be taking the medication anymore or whatever other reason. And we usually come up with an individualized protocol, which I factor in how long they've been doing it, what their values have been at, and what their values were prior to initiation of use.
Alrighty. Next question here. What is your understanding of human growth hormone and its effect on testosterone levels?
So it's one of those precursors, and what it will do is that it will promote the formation of testosterone by the body. So what it'll do is it'll encourage the testis to make its own testosterone. Um, it's a reasonable way to go. Sometimes I'll utilize something like that, or Clomid, which is another medication that's usually used for fertility, but which when it's used to increase sperm counts, it can also be used to increase testosterone because the testes are working harder overall by using that medication. And these are great adjuvant therapies. Now, these are nice therapies because they will boost the testosterone somewhat. They aren't quite as potent as giving the testosterone directly, and sometimes the result is not quite as predictable because you're kind of giving a precursor and then waiting for your body to do something with it and then produce its own testosterone. So there are more steps along the way, as you can imagine. But sometimes when I've got some of the complex cases that I have for certain reasons, I will use a mixture of different medications to kind of get to the result that we need.
Alrighty. A little bit of a follow-up to that question, saw this a couple times, but what are some alternatives to Clomid that are available to raise T levels without shutting down natural reproduction?
Clomid's probably the best one. HCG is the other one, which was described. Those are the two most common that are utilized. Outside of that, of course, we've got the natural therapies like the hormone therapy, the supplement that we described here. A bunch of those ingredients, DHEA, zinc, boron, some of the more potent ones that are in there can definitely help as well. Sometimes we use those as monotherapies, meaning just those, but often, again, it's an adjuvant therapy where we add it to the mix.
I'm going to move along to some more questions here. This next group is about TRT therapy specifically. So what physical and mental changes should you expect with TRT?
So it depends, let's go patient by patient. So some of the things my patients describe, a lot of them describe improved mood, improved sense of well-being. Many will describe improved concentration and just a bit of a blanket term, but mental clarity. These are the things that I hear about a little bit more often. But again, the reason mood is mood is a little bit vague, right? I mean, you can have a decreased mood for multiple reasons. It can be situational. Maybe you're having a bad day, you're having a bad relationship, or more long-term issues like job issues, family issues. Those types of pressures can change things as well. So you may not always see a response. But for men, who are having these consistent sort of problems and have low testosterone levels, supplementing them will sometimes improve those aspects. Concentration, sense of well-being, just improved mood, like you said. You just kind of feel better about yourself. And then, of course, the big one is sexual libido. That's the one that we often see most specifically.
Alrighty. Next question here. How do you feel about oral testosterone?
So it's a good option. It has just recently been starting to gain some popularity. Traditionally, oral testosterone was not used much. The reason why was there was concern for liver dysfunction. The way that the medication was metabolized was kind of concentrating in the liver in a way that it could cause issues there, and that's why a lot of those initial medications were kind of nixed and couldn't pass the test for approval from the FDA. But there is now an oral testosterone supplementation. We do have some patients that utilize it. It's nice because it's really easy, but it's new, right? It's the new kid on the block. It hasn't gained too much popularity yet. There are some other very rare risks like bleeding from the gums or the nose that have been described. Unfortunately, one of the other big issues is that I have not found it to be very well covered by insurance. And, cost is always a factor when you're considering treatment options. And that might be part of the reason why it hasn't gained that much popularity. But I think it's a reasonable medication. It's obviously passed the test at the FDA, so it's been considered overall safe and is being utilized.
Ready. All right, next question here. Can I take testosterone supplements along with my testosterone gel prescription?
Absolutely. So when you're saying supplements, I'm assuming you're meaning natural supplements, kind of like the ones that we had described. You absolutely can, but you want to be monitored because they can have very real effects. So you really need to make sure that your physician is aware that you're taking some of the supplements, so that maybe they'll do a couple of blood tests a little bit sooner to see what the difference is, and kind of adjust the overall, formula with you as appropriate.
Next question here. Would low testosterone make the hair on my face disappear? I now have very little eyebrows and eyelashes and used to have much more.
Absolutely, it can. So testosterone is responsible for many aspects of body composition. Most well known is muscle mass and fat dispersion, but also hair.
Next question here. I had a vasectomy many years ago. Would that affect testosterone levels?
That should not. No, that has been looked at, and vasectomy should have no bearing on that.
Alrighty, so given that testosterone levels decrease with age, would it be worth it for someone 69 years or similar to consider trying TRT for the first time?
So if their levels are low?
Yeah, so I think that what they're saying is they're basically aging and losing testosterone every year. Like, is there any point in me starting a therapy if I'm gonna still lose it?
Yeah. Oh, that's very interesting. That's a good point. Yeah, absolutely. In fact, that's the age range where it's quite popular, late 50s, early 60s, and then beyond. I often see men wanting to move forward with testosterone supplementation. We can catch up. Yes, it might be going down 1% per year, but we'll watch you very closely and make sure it's monitored and, you're having the right levels. If you're having the symptoms and the number is low, it's often worth a try.
Sounds good. Alrighty, next question here. Can testosterone supplement therapy overstimulate your heart like too much caffeine?
That's interesting. Not in that sort of mechanism. Caffeine kind of has a heart rate that starts to race. Testosterone should not do that. I did mention before that there's some pretty big studies about 10 years ago where they had described increased cardiovascular risks like strokes and heart attacks with testosterone replacement therapy. Frankly, a lot of that's been debunked in some of the smaller studies, but we need to have some bigger trials to really confirm whether that's the case or not, whether it is safe for men with cardiovascular risk factors. We're thinking hopefully not, it should not cause any additional risk, but the data's out and we'll be hopefully reporting that soon. But if you have the bigger risk of high testosterone levels is probably blood clots, and that can of course translate into a cardiovascular risk. And so that's a very real phenomenon to be aware of.
Alrighty. Next question here. My doctor increased my testosterone injections from 14 days to 10 days. What is the maximum amount of frequency allowable?
Oh, that's great. So probably they did that. So it is pretty popular to do an injection every 14 days, which is every 2 weeks. But as you saw, a little bit earlier when I was talking about it, when you do an injection, that level peaks within 2 to 3 days and starts to go down. So when you stretch it out by 14 days, you kind of have a yo-yo effect. Feeling great, and then it goes back down, and then you're just waiting for that next injection, then you feel great again. So it's not that even. So tightening up that interval is actually a great idea. So that's a good idea that what your physician is doing, tightening it up to 10 days. You can even tighten it further. I have a lot of my men do once a week, and I have some men that do it twice a week. But you got to really cut down on the dose too, right? So instead of doing 100 units once a week, I'll do 50 units twice a week, just to help it to maintain it so you're not yo-yoing so much and have a little bit more of a steady value. What's the most frequent that you can do it? Probably more than twice a week is not needed, again, because that peak in 2 to 3 days. That's kind of the tightest as I will ever make it.
Alrighty. Now, this question here, a little bit of a review. I believe you said the testosterone cypionate injections are the most effective TRT replacement therapy, but this person wants to know what your preferred method is, or in other terms, the most effective.
So yeah, it really depends man to man, right? I really need to sit down and talk to them and see what their priorities are, see what their lifestyle is like, and then make a decision from there. I tend to start with injections first, just because it's an easy on-off, so they get to try it right away, see if it's working well for them, and there's an easy exit strategy because the value goes down so quickly too when you withdraw the medication. It also goes up fast enough that I can really assess a response. So in the short term, I tend to favor the injections to start, and many men will stay on that. Now, gels are good too. A lot of men are a little hesitant. Again, I mentioned I'm down south, and so men are sweating more, they're out, they're working, so it's a little less popular, I think, for that reason. In the long term, pellets are a great option too. Just that idea to just set it, forget it, and move on with life is really nice for a lot of men, so they're not continuously doing that therapy for themselves.
Alrighty. Next question here. What are the current TRT guidelines for first-time patients that are interested in those topical creams or gels that you mentioned in terms of dosing, I believe is what they're asking.
Got it. So the guidelines, first of all, the American Urological Association is pretty clear. Less than a 300 is when you start to consider it if it's accompanied by symptoms, which we had discussed. Then you go ahead and start the therapy as appropriate. Usually, if I'm doing a gel, I'll do 50 milligrams daily to start with. And if I'm doing an injection, it's usually 100 units weekly is right where I start. I monitor men very closely and kind of titrate from there or adjust from there as appropriate. But again, you know, it comes with certain caveats. What is your health like overall? What are some of your risk factors? And from there, I'll decide whether we want to sometimes be a little less aggressive and slowly scale up, or a little bit more aggressive if your starting value is extremely low, and then, you know, kind of adjust from there.
Alrighty. Next couple, or handful of questions rather, will be about TRT with other conditions. So first one here, this person says they had a stroke about 2 years ago and they now take Eliquis. They want to know if TRT would be suitable for them.
It generally is pretty safe. So, you know, Eliquis, of course, is a blood thinner. For those who don't know, men who are on blood thinners sometimes can't have certain procedures done. So sometimes they worry about doing the injections. But the injection that's utilized is such a tiny needle, you can often do that. What's a little bit more controversial is the stroke side of things, right? So traditionally, men who have high cardiovascular risk factors, such as a stroke or a heart attack, have not been given testosterone replacement therapy. Personally, I think with very close monitoring and appropriate risk-benefit discussion, it's a reasonable thing to do. But you know, we have some large-scale studies coming out that'll hopefully provide some more clarity on that.
Ready. Next question here. I had my prostate removed and the cancer came back and I had radiation and hormone therapy. Is it safe to do testosterone therapy now?
Maybe, maybe not. You know, it's a very individual thing. Again, you know, there was a time where any man who had a history of prostate cancer, it was an absolute no. You can never have testosterone replacement therapy. Now we feel very differently because having a nice testosterone level can be just so important to a man's quality of life. Urologists started to make exceptions. And as they made exceptions, they found that, wow, a lot of these people's cancers and most people's cancer is not coming back. So if we're confident that a cure has been established, whether it be by surgery or radiation or a combination thereof, and we think a cure has been established, then it's pretty safe to go ahead and give testosterone. You just got to monitor very, very closely. That's kind of like the overall thinking. Of course, the level of monitoring really varies. Now, for a man like that was described in the situation that you mentioned here, that's a bit of a higher risk situation, right? Prostate was removed, it came back, required a secondary treatment. Now, if we're confident that that secondary treatment took care of things, it's probably okay to try the testosterone, but I'm probably going to monitor a man like that even closer than I would otherwise.
Alrighty. Next question here. What is testicle atrophy and can it be caused by testosterone replacement therapy?
It can. So, you know, most of the testosterone is developed within the testicles. And so when testosterone replacement therapy is given, the testes themselves often start making less testosterone on their own. In the long term, that can result in testicular atrophy because if the testes aren't doing as much work, the body doesn't dedicate as much resources to them, and they start to atrophy or start to lose their volume. is what atrophy means. So in the long term, absolutely, it can be a real phenomenon.
Alrighty. Next question here. If you were on, or this person, they're currently on immunosuppressing drugs, they're wondering if testosterone replacement therapy will work for them, or will it affect the other treatment?
That's a little bit complicated because it depends on which immunosuppressive drug that is. The other thing you have to consider too is immunosuppressants can have quite a bit of systemic or, larger scale side effects themselves. So sometimes men on those sorts of therapies are having decreased mood, decreased sexual libido, erectile dysfunction, things like that, because they're on the immunosuppressant itself. And so giving testosterone won't be able to counteract it because the low testosterone is not necessarily the reason for it. And again, as mentioned, it kind of depends on which immunosuppressant it is. So that's probably a highly specific question you want to directly check with your urologist. But if there's no major interaction, I mean, it's not an unreasonable thing to try it, as long as, that's one where they're not going to counteract. And your cancer doctor is okay with it, right? Testosterone supplementation can encourage certain cancers, like prostate cancer, for example.
Alrighty. Next question here. Generally speaking, is a prostatectomy patient a candidate for testosterone replacement therapy?
So we touched on that a little bit. If we're confident that a cure has been established, and generally I like to see at least 6 months where the PSA has remained undetectable after the prostate is removed without the need for other things like chemotherapy and ADT and all that kind of stuff. So if we're pretty confident that a cure has been established, then I will consider and talk about the risk benefits of testosterone replacement therapy.
Alrighty. Next question here. This person says, is it common for a doctor to not do pellet injections? My doctor said he doesn't do them.
It is a bit specialized, so not all doctors do the pellet implants. Not all doctors also do the injections. Gel is probably the most commonly seen in my experience among primary care physicians. Amongst urologists, it's gels and injections, but also the implants. But those pellet implants are a little bit specialized. Definitely there's a smaller subset of doctors who have experience doing it. And it's, any doctor is going to be honest with you as to what they're good at and what they're used to. And so they're going to offer those therapies.
Alrighty. Next question we have here. A little bit of a confusing one, but I think it makes sense. Could radiation treatments for prostate cancer affect mental health by causing low testosterone? It's kind of 3 parts there, but.
Gotcha. So radiation treatment can cause fatigue, decreased energy, and there are different mechanisms by which we think that can happen. So we can mimic low testosterone because of those direct effects. Does radiation treatment decrease the function of the testis to the point where low testosterone is made? Probably not. But when a man has radiation treatment, he's often also on something called ADT, androgen deprivation therapy. That's a form of therapy that will actually decrease a man's testosterone while trying to fight the prostate cancer. And so that can cause those effects. So a little bit of a complicated question, but certainly can be related, especially if a man is also on ADT. And even if they're not, it can mimic low testosterone from the energy and things like that I see. Decreased energy and things like that I see.
Alrighty, got a couple more questions and we're going to go ahead and wrap things up. So this question right here, this person would like to know what a good nitric oxide is to take along with testosterone.
So it depends what you're thinking. I'm assuming that is because of concerns about erectile dysfunction. Honestly, when a man has low testosterone and erectile dysfunction, my favorite therapy is actually Cialis, tadalafil. It's a very safe drug. Used concomitantly along with testosterone replacement, can really give a nice, good effect, increase libido while also improving erections.
Alrighty. And our last question of the night is going to be, how long does it take to develop additional breast tissue from testosterone being converted to estrogen?
So I will always monitor men for estrogen levels while they're on testosterone, because some of that testosterone that's being given can be converted to estrogen, and then you can result in some of those side effects like you described, development of breast tissue. So if it's caught early, then you can often prevent that from happening, right? So estrogen levels are often checked, and then there are medications I can give to kind of combat that conversion and the effect from the increased estrogen, along with the testosterone replacement therapy.
If you'd like to learn more, you do have a few options. There are always more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you'd like to compare any of the treatment options mentioned in this event, you can do so by going to menmd.com, navigating to the low T condition page, scrolling down to the treatment section, and selecting up to 3 TRT options to compare. You can also call MenMD at 857-233-5837 or log into the password protected portal to schedule an appointment with a MenMD personal health assistant.